I am Alexis Davis. I'm the social media manager here at RSDSA. I'm joined by Jim Broach, Executive Vice President and Director of RSDSA, and tonight's guest, Dr. Traci Patterson. Dr. Patterson is a CRPS survivor, an expert in CRPS, an internationally renowned clinician, a clinical hypnotist, a published author, a patient advocate, and a motivational speaker. Using her own experience as someone who has been diagnosed with complex regional pain syndrome, Traci has been instrumental in helping CRPS and chronic pain patients regain function and regain their lives through her protocol, Holistic Centered Treatment. Dr. Patterson has treated hundreds of CRPS patients from around the world. Dr. Patterson also created one of the first apps dedicated to CRPS patients, and it's called CRPS Hub. It is a free app, and it will always be a free app. It is available on iOS and Android, and we will be sure to add those links to the Facebook Live description and on YouTube. She also wrote and illustrated a children's book in 2019. It is called Unami the Unicorn, a story of enchantment and healing, and a book about her personal journey with CRPS and gaining remission titled Stepping Outside the Box, a journey from invisible pain to invincible living. Now, please remember that while the information shared here tonight is helpful, remember to consult your physician for personalized medical advice. And now, before we turn it over to Dr. Patterson, Jim, do you have any announcements?
Yes, Alexis, you're going to put the link to join our organization. We just published our monthly newsletter in rare form yesterday, and we started a column, Ask the Lawyer and Ask the Doctor. So we'd love for you to submit some questions, not so much personal, but more global regarding CRPS and its treatment. And the other thing I want to say is that we're coming into some great programs this year. And we're going to do our third annual virtual walk this year on June 11th. And we'd really love for you to participate. And we'll have some information on our website. And then also in Pawtucket, we're going to have a duck race in April. So more of that too. And those yellow ducks are going to be floating down.
Yes, so many fun things coming up.
Yeah, it's exciting. And I'm so excited that Traci's back.
Thanks for having me.
Yeah, Traci, please take her away.
Yes, and before I let Dr. Patterson start, I do want to mention that we just added the link to her presentation to the comments. So if you're having trouble looking at it on your screen, it is in the comments and you can click and follow along. But yes, we will let you kick things off, Dr. Patterson.
Awesome. Well, first and foremost, thank you for joining us here today. I want to, thank the RSDSA for making this possible and giving us this opportunity to really start making a bigger impact, especially with children living with CRPS. It's a big and overwhelming thing for parents to deal with, is they're trying to go through, the different routes of what's working and what's not working. So today we're going to talk about complex regional pain syndrome in children and how to help your child overcome. And that's what we're going to be doing. I want to thank you again for the introduction. Essentially, let me introduce myself real quickly above and beyond what you just heard. My name is Dr. Traci, and I am a CRPS survivor. I was diagnosed with type 2 CRPS following a foot and ankle surgery. That's a common one. And over the course of 7 years, I literally went around the world trying to get my life back. You name it, I did it. And fast forward, I'm now the president of Holistic Centered Treatment and considered also a CRPS expert. Through the years, as they mentioned, I've published the first app that I was aware of for CRPS called the CRPS Hub. It's free on Apple, iOS, and Google. And then we have the book Unami the Unicorn, which is dedicated to young kids dealing with CRPS or any form or diagnoses that deals with chronic pain. And then, of course, my own book, Stepping Outside the Box, The Journey from Invisible Pain to Invincible Living. It's an easy read, and it basically helps people understand, especially parents and caretakers, what do people go through when they're living with CRPS. Now, fast forward, and I have actually been in remission for a little over 8 years now, and I am happy to say that. So one of the things that I want to start talking about is pain and sensitivity and CRPS and the different aspects of that and how that comes into play. Pain, regardless, is a normal human experience. And if we don't experience pain, the reality is we can't survive. People that are born without pain receptors or without that ability to feel pain actually have a lot of injuries and a lot of issues throughout their life. But living in pain, however, it's not normal. And pain can be frightening and overwhelming for us as adults. Now let's think about our kids. It's intimidating, it's isolating, and it's overwhelming, and it's frightening. So in some people, when our pain levels become so high with CRPS, for example, we have extra sensitivity to touch, pressure, clothing, movement, air temperature. Think about even the wagging of a dog's tail and the air that comes off of it. So to put this into perspective, imagine someone touching you with a feather and it should tickle. But instead, sometimes it feels like a blowtorch, and that's what your kids are feeling. And that's a big one for them to be able to understand. So knowledge of how pain works, and let's start pulling together these pieces a little bit. In the last 10 to 15 years, our knowledge of how pain works has really increased through science and research and information that's out there. Prior to that, the main focus has always been on, the joints, the ligaments, the tendons, the tissue, even the bones. But what we know now through science and research is it's the brain and the nervous system that are main contributors to pain. And that's for all pain, irregardless of what that diagnosis is. Now, common mistakes when people are dealing with pain, there's too much emphasis put on the tissues, the muscles, the ligaments, the tendons, the bones, the symptoms, the simple symptoms. Now, think about it this way. A typical strain, a sprain, a fracture, even a surgical site in a typical person will heal in 6 to 8 weeks. So it's important to know what's going on when someone's dealing with ongoing pain. That's reality, is pain that lasts longer than the normal healing period. And I know some people are going, yeah, we know that, but this is a piece of the puzzle. Now, when people are dealing with that, it's more likely due to sensitive nerves and how the brain is actually processing that information and then how it's relayed back into the body. So understanding these simple facts is a great jumping off point. And in my opinion, knowledge is power. Now, CRPS and RSD, it's an important topic, and anybody that's heard me talk, they've worked with me or even done a consult with me will realize that I call a diagnosis a label. Because when we have a multitude of different diagnoses, we feel that we're being weighed down by these labels. Now, many people, especially people that are on this talk or their children, have been given a label of complex regional pain syndrome, CRPS. And their term came out in 1996 when doctors and scientists changed it from reflex sympathetic dystrophy, RSD, to CRPS. Now there's type 1 and there's type 2 CRPS. Type 1 is no known nerve damage or nerve involvement. And type 2 is where we definitively know that there's damage to the nerves or there's nerve involvement. Now, which one does your child have? In my opinion, it doesn't matter, because it signifies one really big thing. Your child is hurting and you need answers and you need help. And the reality is, whether they have type 1 or type 2 CRPS, they're both treated the same way. Now, in my opinion, and people have heard me talk or spoken with me, they're going to hear this term, CRPS is the perfect storm in the brain. And if we think of that perfect storm, and we think about how CRPS occurs, it's the nervous system and the immune system malfunctioning as they respond to an injury, an incident, a surgery, a fracture, a strain, a sprain, or even mosquito bites. And there's that inciting event. There's a lot of stress around that time. And then if we look at a 30, 60, or 90-day window around that, a lot of times there's been a drop in the immune system, thus creating that perfect storm in the brain that can create CRPS. Well, let's go through some basics before we start jumping into more nitty-gritty on this. Complex regional pain syndrome is a condition of the central nervous system when it's oversensitized. And people with CRPS experience a wide range of symptoms. It's not just the pain. They also have what they call vasomotor changes. They have coloration changes and temperature changes, sensitivity to touch. They can have hair and nail growth changes, and that list goes on and on and on. And there's no easy one size fits all when it comes to CRPS and treatment. It's about what's right for your child or what's right for that individual. Now, CRPS, in my opinion, it's not very new and it's not very rare, even though it's classified as a rare disease. It was actually first diagnosed in the United States in the Civil War all the way back in the 1850s. So it's also been called causalgia. And there are also some doctors that will diagnose reflex neurovascular dystrophy, RND. And then in some cases, it's amplified musculoskeletal pain syndrome, or AMPS, that can also be used. Although AMPS is not always synonymous with CRPS. And about a quarter of the children that have amplified pain actually have CRPS. And CRPS can occur in more than one body part, meaning it can be a hand, a foot, a leg, or an arm, but the reality is it can be anywhere. And some people with CRPS actually have it spread throughout their body or to some specific areas, but that doesn't mean that that's always going to happen. Now, it's a misnomer to say that everyone who has total body CRPS has autonomic dysfunction all over too. If we just have amplified muscular pain syndrome, or AMPS, the reality is we may not have the temperature changes. We may not have the coloration changes. So that's a definitive that's in there. Now, there's another syndrome that ties in to CRPS, and that's Ehlers-Danlos syndrome. And there are some children diagnosed with EDS that are also diagnosed with CRPS. And it's even hypothesized that EDS may contribute to the development of CRPS. And it's a couple of different things. It's the way the nerves transverse, or they go through a joint. And when it's hypermobile, you can actually injure that nerve, or the frailty of the nerves in the connective tissue. Even some EDS patients are having to have multiple surgeries, and that can also lead to CRPS. So for the families that are on the call going, what the heck is EDS or Ehlers-Danlos syndrome? First of all, it's not a disease. It's a connective tissue disorder or a syndrome. And when we look at that, the connective tissue is made of what they call collagen. So if we think of collagen, let me give you a couple of metaphors or analogies. Think about a rope that you play tug of war with. Now, if that rope is strong and you've got one person on the left and one person on the right, it's whoever's the strongest that's going to pull that rope one way or the other. But with somebody who has EDS, Ehlers-Danlos syndrome, the reality is that connective tissue, the collagen, is like a rubber band. So when you pull it, it stretches. So the connective tissue is weak, it stretches easily, it can break easily, and the reality is it doesn't heal very well. So two important things to remember: that weak connective tissue, and also poor joint position, meaning hypermobility when it comes to our joints. Now, when children don't meet the definition of CRPS, they fall into that category of localized amplified pain. And there are many children who have pain that's similar to CRPS in a localized part of their body. But again, there's no association between what they call autonomic dysfunction, or the medical word dysautonomia. So layman's terms, that means anything that's automatically supposed to happen in your body is controlled by your autonomic system. Now, some children have localized pain in their limb that's similar to CRPS, but again, they're not having the other symptoms. They're not having the temperature changes, the coloration changes, sweating, hair and nail growth changes, sensitivity to touch. So these are all things that your physicians are looking for when you're diagnosed. Now, there's also what they call coexisting conditions. And the longer the duration of CRPS, meaning the longer someone has CRPS, the more dominoes that can fall, so to say. So one of those things is autonomic dysfunction or dysautonomia. Again, a irregular or dysregulation in your autonomic system, all of the things that are supposed to happen. So our autonomic system is controlling our breath, our breathing, our eyes blinking, our digestive. So the longer CRPS goes on, especially with kids, that's when we're going to hear, my stomach's bothering me, I can't eat certain foods. If the stomach is not emptying properly, then that can lead to gastroparesis. And then there's another thing called POTS. And that is when our heart rate increases or decreases upon changing position. So when somebody goes from lying to sitting or sitting to standing, all of a sudden that dysregulation in the heart will cause dizziness and sometimes even fainting. And yes, these things can go hand in hand with CRPS. It does not mean that they will occur though. Now, the big thing that I want you guys to hear is that living with CRPS can feel lonely. For an adult, it's overwhelming. So I can only encourage you to help your kids get connected with other children their age, or maybe other kids that have an understanding, or even find activities that they can do that they feel up to doing. And that's going to help them kind of take a step back from that isolation piece of this. Now let's start jumping into a little bit more and let's learn about pain. In your body, in every human body on the earth or anywhere in the world, there are over 400 individual nerves. So if you think about that, that's 45 miles of nerves traveling through your body and connecting all of your body, just like a superhighway. And the nerves work like an alarm system. So at times, if the nerves, they're always sending small amounts of electricity or energy traveling through the body. And that's how they send and they receive signals all day long. Now, the nerve's activity will increase or decrease depending on so many different factors: stress, anxiety, our fears, our movement, the temperature. All of these things play a part in that. Now, the nerves are affected by all of these different factors, but yet we also have a threshold of when is that nerve going to fire. So when nerves become sensitive, then they're sending out that signal sooner. But they have to reach this threshold before they actually send out a message or a signal to the brain for analysis and appropriate action, and that's your pain signal. So as soon as that alarm goes off and it sends the message, then all of a sudden it's supposed to calm back down or go back to that resting level. Now, the alarm system and CRPS, when the nerves are extra sensitive, which it happens with CRPS, there's less room prior to hitting that firing level or that threshold. So on the right side of the screen, you're going to see two graphics. One that says before pain, and it has a little squiggly line towards the bottom, and it's really low. That's somebody who doesn't have CRPS. That's our nerve right there. So it has a lot of room before it actually fires, before it sends off a pain signal. Now, on the other side of that is after pain or after CRPS. The reality is there's a squiggly line towards the top of that, and that's when our nerves are extra sensitive and there's a smaller amount of room before our nerves fire and they send that pain signal. So following a diagnosis of CRPS, you may notice that small amounts of stress, small amount of pressure, or even a lower activity level is enough to cause the nerves to fire, to increase that pain level. Now, the main issues when we're dealing with this is the increased sensitivity in the nerves, but fight and flight is also driving that. And that's how your alarm system becomes extra sensitive. Now, fight and flight, let's start delving into that, because fight and flight is the main driver or that mechanism for CRPS. Now, our autonomic system, everything that automatically happens in the body, is broken into two parts. You have your parasympathetic and your sympathetic. And these two are supposed to work as weights and balances. They're supposed to be balanced. They can go up and down all day long, but in the long run, they're pretty close to balanced. Now, the sympathetic nervous system is the area that is activated to keep us out of harm's way. When we have somebody chasing us, we have something happening, our body's meant to go into fight and flight. But then when we're out of danger, it's supposed to calm back down. It's supposed to regulate itself. And one theory suggests that following a trauma and injury or incident with CRPS, that it's triggering the release of fight and flight, but also hormones that are releasing into the body that actually keep it going. So when that sympathetic nervous system is activated into fight and flight, then all of a sudden our brain releases other chemicals, adrenaline and even neoadrenaline. And those are released as a response to physical or even mental stress. So when our body is stuck in this state of fight and flight, that's when other things can start happening, because our brain and our body are not meant to stay up here in fight and flight. So that's when we start seeing other changes taking place, like what they call vasomotor changes. That's the coloration changes, that molten bluish purple where people are like, oh my gosh, my foot looks dead. Or that bright red color where it feels like it's on fire. The temperature changes, swelling, edema, nail changes, sweating changes, all of these things are tied into that. In long term, the longer CRPS goes on, it also has the ability to affect our immune system. So keeping in mind that the brain is ultimately in control of the entire body. The brain is our supercomputer. And we need to realize that fight and flight is the driver or the fuel for CRPS and even other pain conditions. And to address CRPS, we have to address fight and flight. So simply treating the symptoms isn't working. So the important step is being able to stop that fight and flight response in the body and getting the body out of fight and flight, out of that sympathetic overload. And that allows us to start balancing with your parasympathetic and balancing out that autonomic system. Now, our body cannot heal when it's not balanced. That's not the way our body is put together. It's not the way our body functions. So to balance the autonomic system, it'll automatically start dropping those pain levels. And this is what's going to allow our body to heal. So when we understand the biology and the physiology of the body, and then what we call the biology of pain, then we can effectively start treating CRPS. But again, we have to understand that the brain and the nervous system play an important part when dealing with CRPS and most forms of pain. And when we can better understand that, then we have a better understanding on how to treat CRPS. And that's going to allow us to start taking forward steps to eventually finding a cure for CRPS. Now, what do traditional treatments look like when we're looking at all of the treatments that are out there and we're feeling overwhelmed and we feel like we have the weight of the world on our shoulders because our kids are hurting? And this is a condition that we've never heard of. Our physicians can't explain it to us, and we're overwhelmed. Traditional treatments are really going to look at physical and occupational therapy, and I'm a huge proponent for those. Medication, sympathetic blocks, or if it's upper extremity, what they call stellate blocks. Then they're going to talk to you about spinal cord stimulators or neuromodulation. The newest ones are DRG stimulators. When those don't work, they're going to talk about nerve ablation. And for some people, they actually talk to them about pain pumps. Traditional treatments are simply treating the symptoms. They're not getting to the source of CRPS, and they're not addressing fight and flight. And then we have the pediatric pain programs, and their focus is to get your child more functional. And yes, they need to be more functional, so don't get me wrong. But it's also important to get to the underlying factors of this. So yes, it's important to get up and get moving, to get more functional, so we can put on our shoes, our socks, our clothes, we can walk, we're not in a wheelchair, we're not on crutches. But simply telling your child that they have to learn to live with their pain and push through it, that's not the answer, at least not in my opinion. So what about treating the whole person? Having a holistic approach to treating CRPS ultimately means treating the whole person and every aspect of CRPS. As a parent, you know, or anyone living with CRPS knows that it's more than the physical pain. It's physical, it's mental, it's emotional, it's spiritual, it's relational, and I can go on and on from there. But when we start addressing the whole person, that's when we're addressing fight and flight. We're addressing the vagus nerve. We're balancing the autonomic system. We're breaking the pain loop, addressing coexisting conditions, reducing, controlling, and teaching people how to maintain stress, anxiety, and depression, increasing restorative sleep. That's when our body can heal, increase in overall sense of well-being, and giving the individuals the tools so that they can actually live a productive life. So what is the big difference between traditional treatments, pediatric pain programs, and a truly holistic approach? Traditional treatments are simply treating the symptoms. Pediatric pain programs, their focus is to get your child more functional, and yes, that is very important. But simply telling your child that they have to learn to live with their pain and learn to push through it, that's not the answer. Now, a holistic approach is treating the whole body. It's a whole body approach, working with the biology and the physiology of the body, what I call the biology of pain, being able to do what we call systematic neural adaptations, getting your body back into balance, working with the brain and everything else, the nervous system, balancing the autonomic nervous system, and getting the body back into homeostasis where it can physically heal the way it's meant to. And this is how your child can go from surviving to thriving. So holistic center treatment, we're redefining that healing experience through the integration of holistic modalities with cutting edge science. We're pulling it together. Think of it as a blueprint that can be customized to meet each individual patient's specific needs and goals. Because a 7-year-old is going to have different goals and different needs than a 15-year-old, than an 18-year-old, than someone in their 40s or in their 70s. So we have to be able to individualize this to meet their needs. And the approach focuses on treating the whole person and helping the person go from merely feeling like they're surviving so they can thrive, they can get back to all the activities that they want to do. Now, we are as individualized as our fingerprint, and each person's experience with CRPS is also individualized. Therefore, the best outcomes are going to be a program or a protocol that can be individualized to meet your child's specific needs and their goals. So what is our blueprint? What does this look like? And what are we doing? Again, it's a multimodality protocol. Some of the things that we're using are laser. A big fancy word is photobiomodulation, PEMF, neuroplasticity training, biofeedback, neurofeedback, microcurrent, clinical hypnosis, breath work, neurosage, which works with left brain and right brain, and even EMDR. So think of this multimodality protocol as that blueprint, and when it's individualized, it's meeting the specific needs of each person. So for example, if someone doesn't respond well to one particular modality, I can take that modality out of the mix and put something else in its place so that it's going to help them to continue to move forward. I don't believe in suck it up, buttercup. Unlike other programs, we can truly say that we understand CRPS. As someone that lived with type 2 CRPS for 7 years, and November of last year of 2021 was my 8-year anniversary of long-term remission. You name it, I did it, including 2 spinal cord stimulators. I truly can say that I walked a mile in the shoes of those living with CRPS. And that is big, to have someone that can understand, that can be empathetic, understanding, and compassionate, and not push in the wrong direction is a huge plus in my eyes. And what makes us different is all of these things. And that's what helps us see big changes or remarkable changes in the patients that we're treating. So the bottom line is the brain, and it's responsible for every function in your body. Again, I may sound like a broken record, but your brain is the supercomputer of your entire body. It controls every function from the temperature, your blood pressure, your heart rate, your breathing, the digestion of your food, the signals that are being sent out for pain, etc. And it accepts a flood of information 24/7 about the world around us and how we're supposed to respond to what's going on at that moment in time. So when we have that perfect storm in the brain, your brain is responding to that perfect storm and it's sending out the wrong pain signals. And that pain response then triggers a stress response. And that stress response then turn around and it's leading to a release of what they call peptides and hormones and neurochemicals from the brain that then affect other systems in the body. So the first step, in my opinion, to addressing CRPS is really addressing fight and flight, getting the body back out of that sympathetic overload. And that allows us to start balancing the autonomic system. Now, one of the things that I mentioned earlier in the multimodalities that we use is clinical hypnosis. And when we know the biology and the physiology of the body, and the biology of pain, then we can effectively start using tools to help address those. So first and foremost, clinical hypnosis is not mind control. I cannot read someone's mind, nor do I want to. We can not plant a suggestion that somebody would not otherwise give themselves. And just because we're talking about clinical hypnosis does not mean that I'm stating that the pain is made up or it's in your head, quite the opposite. Clinical hypnosis, in my opinion, is the perfect tool because the brain will not allow us to be relaxed and fight and flight at the same time. If we think about a teeter-totter, we can try and balance a teeter-totter, but when one end's down, the other end's up. And the brain won't allow certain things at the same time. When we know that, then we can put pieces in place to be able to get to an end goal. And it's a great non-invasive drug-free tool that helps the body get back into balance, into homeostasis. And in the last 15 years, hypnosis for pain management has been exhaustively researched with modern technology, MRI, PET scans, brain scans, etc. They're able to show changes taking place in the brain when people are in hypnosis. It's evidence-based and it's non-invasive, and it's very helpful with being able to move forward. Another thing that we work with is the vagus nerve. Now, there's a lot of research and talk about the vagus nerve, and that's the 10th cranial nerve, and it is important. It is tied in to your parasympathetic side, that opposite side, and it controls inflammation in the body, including in our nerves, GI function, immune function, etc. And it's also tied in again to that parasympathetic, so one half of that autonomic system. So we have sympathetic, fight and flight, parasympathetic, rest and digest. So the vagus nerve contains sympathetic fibers. So when we stimulate the vagus nerve, not only are we helping to release endorphins and serotonin and melatonin, but we're also helping to balance out that autonomic system. And then we have another big word, neuroplasticity training. So the brain is continually reorganizing itself and forming new neural connections throughout our life. There's an old saying of what fires together, wires together. And the phenomena is known as neuroplasticity. So when we can help the brain to reorganize itself, then that's going to help us make big changes. So let me give you an analogy or a metaphor. Think about a filing cabinet drawer. And for the kids, they're going to go, what is a filing cabinet drawer? For adults, they're going to get it. So everything that we've ever experienced in our life is in our filing cabinet drawer. The older we are or the more experiences we have, the longer that drawer is. And our brain creates an individual file for every single thing. Think about riding a bike. When we first learned how to ride a bike, we needed our bike, we needed our training wheels, and we needed mom or dad running by our side. Then eventually they get so tired of running by our side, they let go and we're teetering around on our training wheels. And then eventually we're riding our bike by ourselves. So our brain has created a file folder for how to ride our bike. Now we can go 1 year, 2 years, 5 years, 10 years and never ride our bike. But when we go and get back on it, our brain remembers exactly how to ride it, and we don't need our training wheels anymore because it's able to get into that file folder. So in that analogy, the first folder that's in your filing cabinet drawer when you're dealing with CRPS is CRPS and everything that we deal with. So every time we go to reach for something, every time there's a temperature change, every time we do anything, the first folder that our brain's getting into is CRPS. So with neuroplasticity, it gives us the ability to go back and grab memories or times or places when we felt our best. And when we do that, it puts it at the front of our filing cabinet. And eventually we can reshuffle our filing cabinet until the CRPS folder becomes a dead folder. That is working with neuroplasticity. We work with laser, also known as photobiomodulation. And laser and LED beams of light can stimulate cells in the body that repair tissue. They can reduce inflammation and even help decrease pain. So the results is a significant reduction in inflammation equal to or better than NSAIDs within a 2-hour period of time. And an NSAID is an anti-inflammatory. It also has analgesic effect that can last for up to 24 hours. We also have other ways of working with it where we can actually break up scar tissue non-invasively. So the reality is it can actually decrease our healing time, and we can heal quicker, up to 70% quicker when using that particular technology. We also work with PEMF. So PEMF therapy stops the release of pain and inflammatory, what they call mediators. It increases the blood flow to our cells, it reduces inflammation, but it also gives the cells back what they call the ionic charge, and it helps them become healthy again. So by reducing inflammation, decreasing pain, it can also increase energy levels, and all of these things help promote a faster healing time. So that's why we use that. We also work with biofeedback, and in biofeedback, we're working with something called heart rate variability. Now, our sympathetic and our parasympathetic both tie in to our heart rate. Our autonomic system is directly tied to our heart rate. So whenever we do something, when we feel pain, our heart rate goes up. Our blood pressure goes up. When we're sad, when we're frustrated, when we're stressed, when we are anxious, our heart rate goes up. So when we can start learning how to work with our heart rate and how it's tied into that autonomic system, that gives us the ability to decrease stress and decrease anxiety, and that in turn has a direct effect on our pain levels. And you'll notice with your kids or anyone living with CRPS, when our stress levels go up, our pain levels go up. So this is a great way of being able to work with that. Another thing that we work with is I have a couple of trained psychologists, board certified, and they're also certified in what we call EMDR, eye movement desensitization and reprocessing. So when we have an emotional charge tied to a memory, for me, I did. After 7 years of CRPS, I had PTSD. Now, we don't like the term PTSD, and a lot of parents with their kids are going to go, we're not going down that road. But the reality is, if they've dealt with a lot of treatments and they have a emotional charge tied to those treatments that's traumatic, EMDR is a great way of reprocessing that information, and then that takes the emotional charge out, which then allows our body to heal. One of the other things that we're doing in the office is thermography. Now, thermography, or a thermographic image, allows us to see temperature changes. So anyone dealing with CRPS can have anywhere from a 2-degree to a 20+ degree temperature change. And there's an old saying that a picture is worth 1,000 words. So this individual had CRPS in a foot and ankle. And if you look at the thermographic image on the left side, just from colors, you can see they're not symmetrical. There's a big difference between the left foot and the right foot. Now, at the end of the intensive, that's the picture on the right side. And you're going to see how symmetrical they are. So one of the things that we see is when we start balancing the autonomic system, because it also controls the temperature regulation and our vascular system, that our temperatures start regulating even in a short 2-week period of time. And that's amazing. Now, as we move forward, I want to share a couple of stories with you. And then I also have a mom with me, Ruthie, that's going to share her experience with her daughter. At Holistic Center Treatment, we put together intensives. This is where we're seeing a bigger difference in a shorter period of time. So we've transitioned over to what we call 2-week intensives, and they're also followed by a 90-day home program. An intensive is about 4 to 5 hours a day, Monday through Friday for 2 weeks. And then that 90-day home program is individualized to that specific person and what their needs are and what their goals are based upon where we're finishing that intensive. And that 90-day program for a lot of people includes physical or occupational therapy. My standpoint as a clinician, but also as someone who lived with CRPS, I didn't want to be away from home for months and months on end. I wanted to be able to go somewhere, get the work done, and then if there was something that I could do at home, like physical therapy or occupational therapy, and get it covered by insurance, why the heck aren't we doing it that way? So that's my outlook on it. So the goal is to help your child get to that point where they're either at a zero pay level or they're more functionable, but then we can continue with them through that 90-day home period. If somebody needs more, we're definitely going to be open to giving that to them. The bottom line is giving them that ability to be able to move forward, get back to school, get back to their activities, and live their life. Now, let me share an outcome with you of a 13-year-old, and this is her running track on the right-hand side, actually cross country. 13 years old, diagnosed with CRPS in her right lower leg and foot. And it started in September 2019. She saw me this year in 2022, and she tried and failed a plethora of treatments. She did a lot of sympathetic blocks. She did PT, OT, chiropractic medications, low-level light therapy, kinesiology, acupuncture, massage, and even an outpatient pediatric program at a highly regarded facility. Now, when she came to me, she was about a 5 out of 10, but within the 24 hours leading up to that, her highest pain level was an 8 out of 10. Her goal going through her 2-week intensive with me was just to get down to a 2 or 3 and be able to get back to school, get back to her friends. Her words, take a bath or a shower without hurting, to be able to plan her trampoline, to be able to sleep throughout the night, hang out with friends, go roller skating. She wanted to get back to gymnastics because she was a competitive gymnast before CRPS. And she also wanted to start thinking about running track. Now, following her 2-week intensive, when she finished and graduated, she put her pain at a 0.5. So she still had some sensations that weren't totally normal. So she didn't put it at a 0, but a 0.5 is pretty darn good. Now, she is about 3 months out. She's just finished her 90-day home program. She's been at a 0 pain level for several months now, and she's in remission. And again, looking at the picture on the right-hand side, she is running cross-country track. She just finished a state meet and actually decreased her time by 2 minutes. She's back to school and about ready to go back to competitive gymnastics. This is a 15-year-old female diagnosed with CRPS in 2000. Well, she actually her pain started in 2013, and she went undiagnosed until 2017. The reality is she's been living with CRPS for 8 years, and she's 15 years old. She had done a multitude of different treatments, too many to even list out. And one of the last things that she had done prior to coming to my office is she went through a pediatric outpatient pain program at Randall Children's, and it was a 1-year program that she went through, extensive PT, OT, pain psychologist, and the lowest that she was able to get to was a 2 out of 10, but that was okay. She could function at a 2 out of 10. But then fast forward to December of last year of 2021, and something happened that sent her into a flare. and she was averaging between a 9 and a 10 out of 10. She was not sleeping. She was starting to have a lot of stomach issues. And according to her mom and according to her, she was majorly struggling physically, mentally, emotionally. The list went on and on. Her goal was just to get back to normal activities, to be able to put shoes on again, and most importantly, to get back to her love of her life, getting back to her horses. Now, she started at a 9 out of 10 on the pain scale, and her CRPS was not just lower extremity, it was also bilateral hands and wrists. At the conclusion of her intensive, she was at a 0 pain level. She was able to put on shoes. Now, she's only a month out, and this is a picture of her from this last weekend on her horse competing, and she actually won first prize. Now, I wish that we could say that everybody's going to be able to get to a 0 pain level. That's not possible, especially not in a 2-week window of time. And I've got a mom, Ruthie, who's going to join me on camera here to share her daughter's journey with CRPS. So this is Ruthie, and her daughter was 7 years old. It's been exactly 1 year. Sorry, she was 9. And it's been 1 year since I treated her. And as a 9-year-old with CRPS, the reality is she had gone through so many invasive procedures and testing, and the list went on and on. And if I remember correctly, when we started, she was at a 10 out of 10.
Yes.
And we only did a 1-week intensive. At that time, I was doing a lot of concierge treatment. I flew out to see you guys at your home. And throughout the week, she ended at a 6 out of 10. But how was your experience in that 1 week, or what would you say to other parents versus the other things that you guys had done?
So when we found Dr. Traci, she had, my 9-year-old daughter at the time, had been diagnosed with CRPS as a result of mosquito bites. She was assigned a team of 6 doctors who were at a large hospital, well-known. They transferred her case to the major children's hospital, and they honestly didn't know what to do with her. They didn't. At one point, I was told or asked if I was willing to put her on opioids, which of course I said no. So when I met Dr. Traci, I looked at her videos. She was extremely responsive. I emailed her one night, in desperation when I found out about her, and she called me the next day. Fast forward, we did the week intensive, and obviously our goal was like everyone else, you want to get to a 0 pain level, because at that point we were just desperate. And at the end of the week, she was at a 6, but that was the first time in over 7 or 8 months that we'd even seen the needle move. No medications had worked. I mean, all the testing, all the invasive procedures that they did on her and tried on her, nothing worked. And so I was a believer, because I told my daughter, it was hard work. I mean, it wasn't just popping a pill. And in today's society, people just want to have a quick fix. It took work, trust me, but we did everything Dr. Traci said. And we saw Dr. Traci last year at the end of February, and our daughter was in remission by beginning to mid-May. And
8-day home program, and also doing some follow-up telehealth.
Yes,
that allowed us to continue to move her forward. And, during that time, yes, she would drop her pain levels and then hit a plateau, then we did some telehealth. And you guys were very great with following the program and doing everything that I was asking you to do. And here we are a year later, and she is still at a 0 pain level
yes.
with her CRPS. So, with your experience going through this, do you have any golden nuggets or anything that you want to share with some of the other parents?
Well, one of the things that's unique about Dr. Traci and her office and protocols is, one of the things with a 9-year-old, I didn't want her to be in a hospital. I didn't want her to be in that sterile type of environment. And Dr. Traci's office here in Idaho is absolutely amazing. and it's very comforting, very relaxing. And what I can say is that again, people are looking for the quick fix. I was a desperate parent. I mean, I had a desperate child, and we were at our wits' end, obviously. And we prayed and we prayed, and I said, God made you, God knows how to fix you. And obviously we got Dr. Traci. But what I would say is, don't give up. Don't give up on options that may require a little bit more work and not just a quick fix, take a pill. We literally did everything that Dr. Traci said. We kept Riley active. We kept her moving. When she would have an episode where the pain increased just for, a few minutes, if we were at the grocery store, we'd stop for a second, kind of redirect her a little bit, and then we kept moving on. And I absolutely, have nothing but amazing things to say about Dr. Traci, because she returned my daughter's life back to normal. I mean, she made her be a kid again. She started tumbling, she started running, starting cartwheels. She was so excited just to be moving. As a mom, I could touch her leg. I mean, it's painful for a parent when you can't even touch your own daughter. And so I would highly recommend, obviously, Dr. Traci, but her methods and protocols, because they do work. They do work, and it frees up your child from being on medication and tied to all this other, just all these meds for life procedures. Exactly.
And other things that are out there. So, I wanted to invite Ruthie to come on and, kind of share, put a name and a face to a parent and someone that I've actually worked with. And I think the big thing is to know that there are treatment options. It's hard to find them. And I think one of the big frustrations is, what's going to be covered by insurance and what's not covered by insurance. The reality is most of the stuff that's working, our program included, it's not covered by insurance. We're working on that. We're levying the insurance companies, and we're doing everything we can. But the reality is, if you've got a child that's dealing with CRPS, for 2 months is too long. For 2 years is way too long. But what about the parents that have been dealing with, like the one example I gave you, for the majority of her life? Everything she could remember was centered around CRPS and the pain. So when we can make that difference so that our kids can get back to school, they can get back to their activities, and they can actually live a fulfilled life, it's hard to really say that we can't do that when insurance isn't covering it. And our job is to try and make things as feasible as possible and help to meet you where you are. So Holistic Center Treatment's putting together the non-invasive and drug-free program that is literally looking at all aspects of CRPS, physically, mentally, emotionally, and even spiritually. So if you've got a child living with CRPS, or if you're an adult watching this living with CRPS, I encourage you to get in touch with us. We do offer free consultations. I always return phone calls and emails. And if it's not the same day, it's the following day. We do consultations over the phone, also through telehealth. And that gives you the opportunity to talk to me, to put a name and a face together, to ask any question that you have, because as far as I'm concerned, I'm an open book. So, my message is simple. People, and especially our kids living with CRPS and chronic pain, they shouldn't have to suffer in silence or through their cries of agony. They need that place that can provide the solutions, that can give them hope and give them the help that they're truly looking for. And my hope is that we can help provide that to more people throughout the United States. And as the pandemic starts slowing down a little bit more, then hopefully internationally again, like we've done in the past. So I'll take it back to Jim and Alexis, so that if there's any questions that have come in, that we can start answering those questions for you.
Traci, thank you. It was really exciting. Just before we get into specific questions, a lot of people joined us later when you were talking about the comorbid conditions that occur with CRPS, and that your interventions could help the EDS, the POTS, whatever.
Right.
Good.
So I think one of the big things to understand is the longer CRPS goes on, and even for some kids, if they're already diagnosed with Ehlers-Danlos syndrome, which is a connective tissue disorder, the reality is that can lead to CRPS. And that's something that there's not a treatment out there that I'm aware of that is going to reverse EDS. So it's about putting things in place that are going to help minimize the symptoms of the pain. And also, I'm a huge proponent for physical therapy and occupational therapy so that they can put in different techniques to strengthen other areas of the body that are going to help with the hypermobility. But yes, the treatment that I've put together, again, is treating the whole person. I've had people come in. I had one young lady who was 24 out of Louisiana who had major stomach issues. She did not have a diagnosis of gastroparesis, but her thing to me on day one was, Traci, I am vegan and I don't want to be vegan. I want to be able to go out with my friends and eat anything I want, anytime I want. And anytime she ate a byproduct that had an animal byproduct, or even something that was cooked on the same stove and there was cross-contamination, she was getting violently ill. And one of the things that we saw with her as her autonomic system started balancing, her pain levels started coming down, she's now eating anything and everything she wants. So, it's important to understand cause and effect. And again, going back into the biology and the physiology of our body. The other big one that people are diagnosed with, and in all reality, when they're not diagnosed with it, I'm surprised, is dysautonomia or autonomic dysfunction. The reality is you are not going to have CRPS if you don't have autonomic dysfunction. It's impossible. So even when we haven't been given that diagnosis formally, the reality is it is a byproduct of CRPS, because our immune system and our autonomic system, specifically autonomic, is not working properly. So by getting the body back into balance or into homeostasis, we see the body starting to regulate, from stomach issues to acid reflux to pain levels dropping. Individuals will say the longer CRPS is going on, my eyesight's getting worse. All of these things start regulating again, and even kids, and it happens with adults, it happens with everybody, but I hear more about it with kids that are athletes. I had a young lady out of Canada who wants to be the first NHL player, and she may still do it. But even one of the big things that they were talking about is POTS, her heart rate. There would be times that she felt like she was having a heart attack, and she went to a cardiologist. They did Holter monitor and everything else, treadmill, and the cardiologist said there's nothing wrong with your heart. So it was pulling back into that dysautonomia and POTS, and that started regulating after she saw me too.
Thank you. Alexis, please. I don't want to do everything.
So we have a good number of questions that have come in. And I will also note, and Jim just mentioned that we did have some people who joined at different parts of the presentation. So I apologize if anything is, a repeat of something you mentioned or anything, but definitely want to make sure we're able to help. So
Absolutely.
One of the questions, like I said, there's so many questions, I'm trying to figure out exactly where to start. How do you help a child get a normal sleep schedule? And I guess this also applies for adults, if they're constantly in pain. This one person is saying that, this child wants to sleep because her pain is gone when she's asleep, but she can't because she crashes after being exhausted all day.
Right.
What tips or advice could you give, this parent?
So one of the things that we see here is when we're going through and starting to get the body out of fight and flight, that's when sleep is increasing. So it's what comes first, the horse, the cart, the chicken, or the egg? Because when we have pain levels that are really high and our body's in fight and flight, we're not meant to sleep when our body's in fight and flight when it's supposed to happen. But the reality is these things, they're occurring. So, on your own, it is difficult. We've found different devices that help. One of the things to keep in mind is our brain will mimic a frequency or a signal. So there are some sleep files that are out there on the internet that actually have an embedded delta wave in it. And that type of a file, the brain will mimic that delta wave, and it's easier to get into a sleep pattern. So that's something that people can try. But when I'm working with individuals, one of the key pieces is starting to get the body out of fight and flight. And when that starts happening, that's when pain levels are decreasing, and that's when it's easier for them to sleep. Unfortunately, there's not an easy answer for that.
Right, I can definitely understand that. There was another question someone asked, have you seen children who also have light and noise sensitivity with their CRPS?
Yes, that I've seen it in children and adults. So the reality is our whole nervous system is tied together. And when we look at a picture of the brain and all of the nerves in the body, everything is tied together. So we have to start balancing that out. But with CRPS, you've got people that do have the light sensitivity. Your ocular nerve can get involved. And then the other individuals that have sound sensitivity, whether it's tinnitus, whether it's the ringing in their ears. There's also a condition called hyperacusis, where setting down something, let's say keys or a utensil on a table, that sound is amplified to them because their nerves are not firing correctly, and they're what I'm going to call extra sensitive without getting into a bunch of medical jargon. So yes, I have seen that.
Alexis, can I ask a question? So Traci, a lot of times the treatment, especially the pediatric, the children's hospitals are not following up with their children, and when I ask them about it, they say, well, they get older and their dress changes and whatever. What about your follow-up with people you have treated, both adults and children?
So the week after they finish with me, they're getting a follow-up. And we ask before they leave the office, what's the best way to follow up with them? We give them the choice of an email, a text message, or a phone call. So based upon their preference is how we follow up. Right around 30 days, 60 days, 90 days, 6 months, and even after that, I am still following these guys because I want to know they're doing well. And if there's something that's small that we can change, we can alter, or I can give them some suggestions that's going to get them back on track and help them move forward, I want to do that. As someone that's lived with CRPS, people don't understand it before they come and see me, but I want them to reach their goals just as badly as they do. I want everybody out there that's living with CRPS to be able to get the same thing that I've been able to get, and that's my life back. But I think that the mom that we just had on camera with us, Ruthie, is a good example. The week after I finished with them, they got a phone call and a text message, hey, how are things going? And that keeps the door open for them. So what I tell them is even in between my checking in, if they need something, I'm encouraging them to call my office, to text me, or to email me. And then that gives us the ability to set up a telehealth to figure out what's going on, or to put some other things in place that are going to help them move forward. So ultimately, yes, we are doing all of that.
Alexis, one more. I know, Traci, you're trying to get insurance coverage, and so many things are off label. Is there a dollar figure, 1 or 2 weeks that people have to budget for?
Yes. So everything's transparent. I don't have any hidden agendas or anything else. A 1 week intensive is $6,000. 2 week intensive is $9,900. Both of those include their 90-day follow-up. And the reality is, if somebody needs follow-up past 90 days, I'm still going to do it, and I'm not going to charge them for it. I sincerely, as someone who's walked in their footsteps, in my lifetime, I want to find a cure for CRPS. I don't know if it's going to happen or not, but I know that those are still lofty dollar amounts for anyone to deal with. But, the reality is we are trying to partner with different nonprofits so that we can help raise funds and potentially offer some grants or scholarships to help offset part of that. And we don't know how long it's going to take insurance. We thought we had the door opened, and all of a sudden it got closed on us. And we've even been able to show how our program is less than 10% of what they're paying in 1 year for CRPS treatment, but they still don't want to cover it. So, we're trying to keep the costs as reasonable as possible, giving them the follow-up. But again, in the next, and I don't know, I can't hold me to numbers, but in the next 6 months to a year, the goal is to have scholarship and or grant money available to help offset part of this.
Thank you. Alexis, please.
No, those were great questions. You just took two of mine. I actually just put a presentation in the chat here from Dr. Heitman, who we had come on. That was last year. There's a few questions that people are asking regarding CRPS in the eyes. And what you just answered is like, wow, this is something that, is eye-opening. They're like, I didn't realize that these two things were connected. And Brandy's also saying thank you for, grants and scholarships. They're so important. So, but yes, Jim, you took two of my questions, but they of course are great questions. So we have a few questions left. Some of these aren't necessarily related to CRPS in children, but hopefully I understand this question right. But someone just asking, do you use rolfing in your practice?
No.
Okay.
No, we don't.
Okay. And then another question that we had come through is, how does neuroplasticity work for, I guess, anyone, but this person says a 50-year-old who has suffered with CRPS for years?
Well, the reality is again, going back into, since they're 50, they'll understand the analogy of my filing cabinet drawer. Kids, I've got to switch it over to supercomputers and doing searches on the computer. Right. But a 50-year-old is going to understand what a filing cabinet drawer is. So believe it or not, I've worked with one individual that had CRPS for 27 years. I had another individual that was misdiagnosed for a decade. And when we followed the line back, they actually started their CRPS journey in the late 80s. So that's approximately 40 years of CRPS. Our brain creates that file folder. So it doesn't matter whether someone's been dealing with CRPS for a day, a week, a month, a year, or 10 years, or 20 years. The reality is we still have the ability to work with neuroplasticity. Our, what they call neuronet in the brain, is always changing. Our brain is always adjusting every single day, every second of every minute of every day. But it's about being able to get in there and work with it. So people that have had CRPS for a long time, or I'll even take it back to the 15-year-old that I just used as an example, since she was 7, that's all she could remember. So essentially all she could remember was CRPS. But what we could do is we could find some little windows of time where she did an activity or she did something and she was happy, she was joyous. So that's another way of being able to work with it. But there are different things that we can do to find workarounds for people that have been dealing with CRPS for long durations of time. But the reality is it doesn't matter. Our brain has the ability to rewire. And I'll give you one metaphor and then we'll move on. Think about taking a walk on the beach. Every single time you take one step, you leave one footprint. So when we deal with something once, it's like leaving one footprint in the sand. But when we're dealing with CRPS, you might as well grab your shovel and start digging a hole. Now, your hole can even be 2 feet deep on that beach. But if someone can finally give you a chair where you can sit down and you watch the waves coming ashore and the tide shifting, even if your hole is 2 feet deep, it's going to even back out. So the same way that the beach has to have help to cleanse itself to even back out, our brain has that same ability. So yes, it can be done.
Alexis, Traci, I know that when you were treating adults, you used to travel across the country if people couldn't come to you. Is that still an option?
It is an option. It's more difficult. And part of the reason why I'm encouraging people to come to the office is when I was in private practice in California, I didn't have every modality that I've got in my office right now. So there are certain things that I physically can't take with me. Yes, my laser will pack up, believe it or not, and it's traveled to so many different destinations. But certain other things like NeuroSage that works with left brain and right brain, I can't take that with me. I can't take my EMDR therapist with me on a plane. There's certain things that I just can't do. Now, if it's a choice between somebody not getting the help they need and using fewer modalities versus coming to the office, am I going to adapt? Of course. With COVID and the pandemic, we had to really adapt. So one of the other things that we put into place was what we call an integrative telehealth. Do I feel like it's as effective as being in the office? No, because I can't use a laser through telehealth. I can't do PEMF through telehealth. The reason why it's called integrative is because there are certain modalities that are FDA cleared that I can legally send to someone and they can keep them. But the reality is where people are going to get the best outcomes, it's going to be here in the office. And part of the move from Southern California, and people think I'm crazy, to Idaho, is the fact that it allowed us to take that next step to be able to put in just a full clinic and in a healing environment. If you walk into my clinic, it's couches and recliners and pillows and massage tables. It's all about comfort. And it's all about putting together a healing environment rather than a cold, sterile office where their stress levels just continue to go up. So hopefully that helps.
I understand. Mm-hmm.
We did have another question that just came through from Jeff, who's asking, are there any specific vitamins you'd recommend in conjunction with treatment?
Obviously, depending on each individual, some of the things that are going to help, and they're already out there. Now, without being, the individual treating them, can I recommend or provide medical advice? No, I can't. What I will say is there's a lot of supplements that are out there that are helpful. Turmeric is good for decreasing inflammation. The problem is not everybody can take it. So I can't just give you an across the board recommendation. Ashwagandha is great for stress and increasing sense of well-being. But the problem is if somebody's bipolar or on medications that are dealing with bipolar, ashwagandha will interact with that. So yes, there are supplements that can help. No, I'm not comfortable giving out a whole list of them on here because I don't know if there's coexisting conditions. I don't know if people are on medications that could interact. But yes, there are supplements that can help.
Hey, and then you're getting a lot of love from Stephanie Olson, who's been commenting. She's saying hello to you.
Well, her daughter is one of them that was used in here, so that's why.
Traci,
And then last,
is there any
Go ahead,
medications that people have to stop before they come see you?
No. As a matter of fact, if people are on medications, I'm probably one of the few people out there that's going to ask them to stay on any medications that they're on. The reason why I do that is as soon as we start changing a bunch of variables, I don't know what's working and what's not working. And over the years, I had one individual that was actually on a nasal ketamine, and she was feeling well enough halfway through the week that she just stopped taking it. And then all of a sudden in 24 hours, she thinks she has the flu. I'm playing the sleuth over here and realize it's not the flu. She's going through withdrawal symptoms. So then we had to deal with those before being able to pick up the pieces and help with anything else. So no, my adage is if somebody's on medications, let's stay consistent. And then when they're done, I may even ask them to stay on their medications for the remainder of the 90-day period, and then work hand in hand with a prescribing physician to titrate down in a responsible way.
Thank you.
all right, well, we have one more question. But before I ask that, we did also have, I apologize if I mispronounced your name, Shakria Haman, who also said, tell her that I said hello as well.
Awesome.
And so the last question that we have this evening is from Shannon, who's asking, can you recommend any literature to provide to caregivers to help educate them on how to care for CRPS or RSD patients?
I think as far as caring for them, it's difficult. If they go into the CRPS Hub, there is a section on there for caretakers. And we're always adding additional information, resources into that also. So that's a good place to be able to go. You know, I know the RSDSA, you guys have a really good link to information for caregivers too. So, you know, use the mechanisms and, you know, the links that are out there. RSDSA, great resource. CRPS Hub has some resources on there too. So those are two really good places to go.
There's also a Facebook group for caregivers people with CRPS.
Well, those are all the questions that we have this evening. I definitely want to thank you, Dr. Patterson, for not only speaking this evening, but also, of course, speaking at our conference that we had last year. It was awesome. So as always, we will have this video pinned to the top of our Facebook timeline for easy access if you want to rewatch it. And we will also upload it to YouTube. So if you have any friends or family members who are not on Facebook, they can watch us on YouTube. So be sure to point them to our channel. We will also add a link to the presentation to the description of the YouTube channel, and of course, to this video, and it is already on our website if you want to go back through Dr. Patterson's slides. Now, be sure to save the date for our next Facebook Live. It will be on Tuesday, so not a Thursday Live, but Tuesday, March 1st at 7 p.m. Eastern, as we'll be speaking to Dr. Steve Ahrens for a Q&A on dealing with chronic pain in our healthcare system. And we will definitely make sure that we open up the floor for questions. We will definitely ask for questions via our newsletter as well as social media. So as
just one thing, Dr. Ahrens is a pharmacist, a retired pharmacist, and he's been so active during this whole terrible CDC guidelines and try to help people with access to care. So that's where he's a wonderful advocate.
Yes, that is a very good point. Thank you for mentioning that, Jim. So once again, if you have any questions for us, if you need a support group, if you're looking for a new physician, or if you want to write for our blog, we definitely got a few emails this week. Hopefully we're going to get some new blog writers. Be sure to send us an email at info@rsds.org. And we look forward to seeing you on our next Facebook Live. Y'all have a good one.
Bye.
Bye.